Have you ever felt a sudden click, pop, or lock in your knee, especially after twisting or turning? That might be more than just a sprain. Today let's talk about one of the most common causes of knee pain, meniscus tears. The knee has two menisci, soft cartilage pads between your thigh bone and shin bone. The lateral meniscus is circular and covers about 70% of the outer knee. The medial meniscus is C-shaped and covers about 50% of the inner knee. They act like shock absorbers, help with load distribution, and keep the joint stable. So how do they get torn? Common causes include sudden twisting, jumping, or quick direction changes, like in football, basketball, or skiing. Degeneration, which means the cartilage just wears out over time, especially in people over 50. It can also happen along with arthritis or after injuries like an ACL tear. Symptoms. Here's what you might feel. Pain on either the inside or outside of the knee, clicking, locking, or giving way, swelling, sometimes immediate, sometimes hours later, and a very specific pain when pressing on the joint line. That's a key clinical sign. Doctors often use a simple test called the McMurray Test. They'll bend your knee, rotate it slightly, then straighten it. If they feel or hear a pop and it hurts, that's a red flag for a meniscus tear. But the gold standard for diagnosis is usually an MRI. A clever detail: if you can see both the front and back parts of the lateral meniscus in the same view, it's probably torn. That's because the lateral one is circular, unlike the medial one. So how do we treat it? If the tear is small or not in a critical spot, we go with conservative treatment, rest, physiotherapy, maybe even a steroid injection to calm things down. But when the tear causes persistent pain or locking, that's where surgery comes in, and we have two main options. 1. Meniscectomy, removing the torn part. It's quicker, but if too much is removed, the joint may wear out faster. 2. Meniscus repair, stitching it back. Takes longer to heal but preserves the structure, especially good for young, active people and when done along with ACL reconstruction. Let's wrap up with some quick facts. Medial meniscus tears are more common, especially in older adults. Lateral meniscus tears are more common in acute ACL injuries. Healing depends on tear location, age, and joint stability. Ignoring symptoms can lead to arthritis and chronic instability. If your knee keeps locking, clicking, or hurting, don't ignore it. It could be your meniscus telling you something's wrong. Thanks for watching. If you found this helpful, hit like, and share it with someone who needs to hear this. Stay well, and take care of those knees.